sir, good morning. I'm Andrea Asuncion, your student nurse from Medical Colleges of Northern Philippines. So today po, I will assess your thorax and lungs. So sir, may I know your name po?
Mark Justin Benitez.
Okay, thank you sir. Then after that, performance hygiene. And then help the patient to undress if needed and provide gown. Also, assist the patient in sitting position to expose the posterior thorax. So, since the patient is already sitting, okay, so I will now do the process. Okay, so to do the procedure, first inspect the patient's posterior thorax, and then examine the skin, the bones, the muscle of the spine, the shoulder blades, and as well as the symmetry of expansion and accessory muscle during the expiration. Okay, and then assess the anterior, posterior, and lateral diameters of the thorax. Okay. Sir, pwede pong so the diameter of the thorax of the patient is 1:2 ratio. And then next is palpate over the spine and posterior thorax. Okay. So in palpating the temperature, I will use my dorsal surface of my hand. Okay. And then in palpating for tenderness, muscle development, and masses, I will use my palmar surface of my hand. Okay. So, sir, huminga po kayo ng malalim and then say 99 po. Then, ulitin niyo po yun kapag i-move ko ulit tong kamay ko. Okay? So, sir, deep breath po.
99. 99. 99. 99.
Okay, thank you, sir. Okay, then next, assess the thoracic expansion by standing behind the patient. And then by placing my both hands to either the side of the patient's spine at the level of T9 or T10. Okay. So, sir, pwede po kayong tumayo po. Okay. Then, hinga po kayo ng malalim. Okay, thank you sir. Pwede na po kayong umupo. And then, after assessing the thorax expansion, let's move on to the percussion over the posterior and lateral lung fields for tone using zigzag patterns. Okay, so and after that, assume that I already know the intensity, pitch, duration, and quality of sounds produced. Okay, then next, let's move on to the auscultation of the lungs. And okay, then next, let's move on to the auscultation of the lungs across and down the posterior thorax. So for auscultation, I will use a stethoscope. Okay, so, sir, huminga po kayo ng very slowly lang po.
Yeah.
Okay, so thank you, sir. So, as I hear, there's no other there's no other sounds like wheezes, crackles, or any sounds that or any abnormal sounds. Okay, so after assessing the posterior thorax of the patient, we will also assess the anterior thorax of the patient. So let's assume that I already did that, and now let's move on to the inspection of the breast and axillae of the patient. Okay, so sir, can you stand up po? Okay, and rest your sepet po for assessing your to inspect the breast and axillae. Then sir, can you place your hands like this? Okay, thank you, sir. And then put up your hands po. Okay, thank you, sir. Pwede na po kayong umupo, sir. And then, after inspection, let's move on to the palpation of the patient's axillae. Okay, so after palpation of the patient's axillae, let's assist the patient into supine position. So since we do not have a bed, so let's assume that the patient is in supine position and put a small pillow at the back of the patient for the exposure of for the palpation of the breast and nipples, and then wear gloves if any discharge from the nipples, or if there are any lesions of the patient's breast. And then after that, assist the patient in replacing the gown and then perform hand hygiene. Okay, so sir, thank you po sa inyong cooperation. That's it po for today.